Hi there. Let's talk about one of the most important questions you'll ask during patient registration when a patient has Medicare, the Medicare Secondary Payer Questionnaire, or MSPQ. As a patient access representative, your role goes far beyond collecting demographics and insurance cards. When a patient is covered by Medicare, it is your responsibility to ask MSPQ questions to determine whether Medicare should be billed as the primary payer or the secondary payer. This step is required, and skipping it or completing it inaccurately can lead to serious billing and compliance issues. So, what is the purpose of the MSPQ? The MSPQ is used to find out if another insurance plan, such as employer coverage, workers' compensation, liability insurance, or no-fault insurance, should pay before Medicare. Medicare rules require healthcare organizations to identify other potential coverage before submitting a claim. That means Medicare does not always pay first, even if the patient has a Medicare card. This is why the MSPQ is required during patient registration. Registration is the point where insurance information is captured, verified, and validated. The MSPQ ensures the correct payer order is established before services are billed. Here's why that matters. If Medicare is mistakenly billed as the primary payer when it should have been secondary, the claim may deny. That denial can cause delays in payment, rework for billing teams, and frustration for patients. Accurate MSPQ completion helps produce clean claims and supports faster, correct reimbursement. The MSPQ also supports regulatory compliance. Medicare requires providers to make a good faith effort to ask specific questions at registration to identify other coverage. By asking the MSPQ questions consistently and documenting patient responses accurately, you help the organization stay compliant with Medicare rules. As a patient access representative, you are not expected to make coverage decisions, but you are expected to ask the correct questions and record the answers exactly as provided by the patient. Your role is to collect, not interpret. For example, MSPQ questions may ask whether the patient is currently working, whether they are covered under a spouse's employer plan, or whether their visit is related to an accident or injury. Each answer helps determine if Medicare is primary or secondary. Let's summarize what you should remember. The purpose of the MSPQ is to identify other insurance coverage that may pay before Medicare. The MSPQ is required during patient registration to establish the correct billing order, support Medicare compliance, and reduce claim denials. Completing the MSPQ accurately and consistently is a shared responsibility, but it starts with you in patient access. By asking the MSPQ questions every time Medicare coverage is present, you help protect the organization, support downstream billing teams, and create a smoother experience for patients. That's the why behind the MSPQ and why your role in this process truly matters.